Good evening, ladies and gentlemen. I'm very delighted to welcome you all to our 2017 World AIDS Day event in the Royal Irish Academy. And I want, first of all, to acknowledge the presence of members of the diplomatic community who have joined us tonight. And I want to extend a very special thanks to the Irish Forum for Global Health, who have organised the event along with my own department, and especially to the, as Rory said, to the Royal Irish Academy for hosting this year's event and welcoming it into this extraordinary place. This year marks the 12th in a series of World AIDS Day lectures by the inspirational Professor Father Michael Kelly. And while Father Michael is not physically present with us here tonight, he continues to inspire all of us with his insights and his deep understanding of how to overcome the AIDS pandemic in his adopted country of Zambia, and indeed throughout the developing and developed world. We are once again honoured tonight to have members of Father Michael's family join us this evening, and I want to especially welcome them here tonight. Father Michael constantly reminds us that although there has been real progress in the battle against AIDS, that battle is far from over. And his approach reflects the principle of leaving no one behind, which is central to the Sustainable Development Goals. And this year's World AIDS Day lecture is focused on youth and HIV. And in terms of access to health and other basic services, young women and men have too often been left the furthest behind. And there's ever-increasing evidence of the particular vulnerability of adolescents and young people to HIV infection, particularly females between the ages of 15 and 24. And I believe that if we are to make significant inroads into reducing HIV transmission among this particular age group, that would represent a very significant step towards ending AIDS by 2030. I want to extend a very special welcome to our two guest speakers tonight, both of whom have played a very important role in ensuring that young people are fully included in that fight against HIV and AIDS. Dafina Bahu, a youth peer educator from Uganda, is a courageous and inspirational representative of young people living with HIV and AIDS. And Dafine is also the star of an award-winning short film, A Positive Life, produced by the International AIDS Alliance last year. Dr. Chue Loo has worked for 20 years on HIV and child health as a clinician, as a researcher, and now as chief of HIV/AIDS for UNICEF, and she's based in New York. And we're looking very much forward to hearing both of them speak tonight and to learn from their personal experience, their deep knowledge and their work in this area. As more information becomes available about HIV and AIDS, Ireland and our partners are adapting our approach to ensure that we use public funds in the most effective way. And increasingly, our programmes must focus on providing young people with the knowledge and the information that they need to protect themselves from HIV, including through keeping girls in school and supporting comprehensive sexuality education. We are firm in our belief that education can make a significant difference, and this belief was formed with significant input from Father Michael himself. And as an educator, he saw the opportunity that education provided as a social vaccine against that pandemic. By merely keeping adolescent girls in school one additional year, the chances of HIV infection reduces by 12%. We have also increased our support to youth-friendly services, working in partnership with other organisations such as UNAIDS, UNICEF and UNFPA in Uganda. Through our support, we are ensuring that young people can access a range of services that are provided in a welcoming, confidential, conveniently located and affordable way. We recognise that overcoming stigma and discrimination remains central to ensuring that young people access the services and the information that they need. And did you know that the very first Professor Michael Kelly lecture on HIV and AIDS was not only held here in the Royal Irish Academy, but it was on the theme of stigma and discrimination. So 12 years on, and despite very significant progress in tackling that global pandemic, the issue of stigma and discrimination is still pervasive and remains one of the foremost barriers to HIV prevention, HIV treatment, care and support. My department remains fully committed to using this annual lecture series and indeed other events to raise awareness of the issues associated with HIV and AIDS and to share experiences for the benefit of people living with and affected by HIV and AIDS at home and abroad. And this year, we especially recognise that young people at home and abroad must be able to shape their own destiny. It is only by working together that we can end AIDS, and I'm very sure that the learning we are going to derive, the experience here tonight, can certainly work in supporting all of us in the work that we do to ultimately bring an end to HIV and AIDS by 2030. A noble ambition and one that we look forward to working towards. Thank you.